Say I'm coming to your office now and I'm not showing signs of anything really significant, but I really don't want to spend my copay for an MRI. I really don't have time to go to therapy. But it hurts to sleep on that side, and it hurts when I pick my arm up and move. I have trouble putting my jacket or shirt on. I have trouble washing my hair in the morning or brushing my teeth.
Just activities of daily living.
Right.
Yes.
Show me what type of signs somebody could expect to have, other than what I just said, that would make them think that, or make you think that they have bursitis, and tell us how you would treat it.
So when that air pocket moves and it hurts, it's called bursitis. So for example, raising your hand overhead, reaching an upper counter, for example, in the kitchen, or picking something heavy, or pulling or pushing, those symptoms, and it just is nagging. And you ask the patient and they say, yeah, in the last 3 months it's not only gotten better, it's actually slowly getting worse. I wake up at night with some ache and I got to massage it, or I got to put heat or cold on it. So those simple things folks will do. But itis, meaning inflammation, so we try our bread and butter anti-inflammatory medications, physical therapy. We try to strengthen the core of the shoulder, which is called rotator cuff. I'm sure we'll talk about it soon. Those rotator cuff are basically balancing forces between the ball and socket, holding the ball into the socket as it moves around. So we try to work with those 4, or if you want to argue 5, core muscles of the shoulder, then that eventually, as the shoulder gets core stronger, the bursitis gets lesser and lesser.
So to summarize, bursitis can be injected. It can be given anti-inflammatory pills with great caution, and I think personally, to throw this out there, that you should never take an anti-inflammatory pill without taking a stomach protective medicine such as Nexium. Zantac off the market now. But medicines like that, I think, in my practice, are one prescription doesn't get written without the other. Believe they go together, and if your insurance company doesn't pay for it, then I won't write you the prescription unless you take an over-the-counter, at least strength of stomach protective medicine.